few people will come trickling down once the other lecturer comes out. But just to introduce ourselves, I'm Lorri. I'm one of the RVTs around here.
And I'm Tanya Harbison. I'm one of the RVTs here, and I run the fecals if anybody has questions. I'll be the one calling you.
Yep. So just kind of a little brief introduction of what we do around here. So as an RVT, we're the technicians. So we do have degrees in this, and it's a 2-year program. So really we act as kind of the eyes and ears for the horse, and we're like the first line of defense. When a horse gets trailered here or we come out to you guys, we're usually the first person that actually, gets to touch the horse, gets to, figure out what's going on. So, we're screening for diseases, we're screening for problems before, the vet comes out. And we're really the advocates for your horse. We're the ones that are in the hospital that, see the patients every day, and then, notify the doctors from there. But we really try and be the voice of the patients. So with that, one of the first things that we do is take a basic exam, and that typically includes basically monitoring all of the organ systems. So we usually call it, you probably hear us referring it to as the TPR. So it's the temperature, the pulse, and the respiration rate. But beyond the numbers, we're trying to get just a general appreciation for the status of the horse. So really, the first thing that we like to do is before we even go touch the horse, before we even, start talking to the people, getting a history of what's going on, we just want to stand back and see what the patient is doing, in their natural status right now. Are they anxious? Are they, depressed? Are they quiet? Usually I'll try and get the respiration rate just, from afar, because you can see it. We look, the easiest place to see it, is this flank and the lower flank, and just count, and it's actually easier to see it if you're standing from a little ways back. And we like to do that before we go start messing with the patient, because as soon as we approach the horse, their mental state is going to change. They could get anxious. They could, get nervous around what we're doing. If they don't like their ears getting touched, and we start messing with their head, then their respiration is going to increase. They're going to change their mental status based on their environment, and we want to see them just how they are at that state. So if you look on your the lecture notes, which is on the back side, so that's just kind of the observation, and you also want to note, like I said, mentation. Are they quiet? Are they anxious? The normal for mental state is they're bright, they're interested, they're alert, and they're responsive. So if I do something, yes, hello. He's like, there's a lot going on.
Like, I'm just watching these people out.
His ears are up. He's watching everybody. I can see that he's reacting to all the flies on his face. He's, twitching as they land on him. So he's responding to his environment. He's bright. He's alert. So that's all good stuff, and indicates a lot to us. I mean, you may just say, okay, he's standing there, but that's giving us a lot of information as far as how he's feeling, his neurological state. He is acting like a horse should at this point.
Okay, so like she said, that is a normal state. However, if you tell us, my horse is usually jumping around like a crazy person, and he's standing there, well, we would consider that lethargic, right? He's not comfortable. He's like, something's going on with the system. Well, first of all, we also look at their, nasal passages, if there's anything coming out, discharge, if that's not normal. I'm like, he's not going to work with me. And then we kind of work our way back as well. So nasal discharge, eye discharge. We look at their gum color. So it's a nice pretty pink in his case. That's what we want to see. We also check the CRT, which is the capillary refill time. We'll press down on it, see if it comes back from the white tail color to the pink. How many seconds that is. That kind of gives us an idea of, their refill time, which is their blood coming back to us. So we do that. We check them. We listen to their heart rate. So we not only get a count, but we listen for heart murmurs, anything that might be different. Respiratory rate, we listen to their lungs, listen to their gut sounds. We kind of get that idea. So what we'll do is we'll kind of give you an example, and maybe we'll ask for a couple of volunteers so you can kind of come listen to the heart rate, see what it sounds like, because it's a little sometimes difficult to hear on a horse, but I think he's got a pretty clear heart.
More difficult than you would think it is based on their size, and you're like, oh, their heart is giant. It must, be easy to find. And some of these like really big barreled, big chested horses, it can be really challenging. And I also think it's really important to kind of develop a systematic approach to assessing your horse. It's really tempting to just get the quick numbers, get your TPR numbers going and just stop there. But you really want to develop that systematic approach to starting at the head and working back. And even if what set you off was, oh, I think they're breathing funny, and you just look at the respiratory rate, you might be missing things that also could be wrong with the horse. So you want to start from the nose, and maybe they have nasal discharge, maybe there's other things that could be going on with the horse, not just the one thing that you happen to notice. So just appreciating the whole horse as the whole, and getting that systematic approach.
And you as the client know your horse the best, so what we think may be normal for your horse may be slightly off because they're a more anxious horse, or for whatever reason their vitals are slightly off, like the temperature, for example. Some horses run a little cooler than others. So if your horse has a 98-degree temperature, he's not cold, he's okay, it's fine, it's a normal temperature for that horse. So whereas the normal vitals would be around 99 or 100. So,
and that's really important information for us in the hospital, because if your horse is sick and has to get trailered here, and we go take a TPR on the horse and we say, oh, well, his temperature is 101, and we say, well, that's kind of on the verge of being a little bit high, but if you guys as owners have consistently taken, an exam on your own horse and say, oh, you know what, I take his temperature all the time, he's always a little bit high, that tells us that, okay, it's nothing to worry about, that's just normal for this horse. It's not some external factors working on the horse. So it gives us, really good information that we use when your horse is sick and needs to come see us.
So let's start an exam.
Yep.
Work our way back.
Go for it.
So, do you want to just talk them through?
Yeah, sure. So I always have a watch on me just because it's easy. What I usually do with taking respiration is, like I said, do that first so you're not changing anything. Normal respiration for horses is between 10 and 20 is what we usually see. A nice, calm, relaxed horse is going to be about 12. If your horse is coming in off the trailer, or in a high stress situation, then it's normal based on the environment. If it is a little bit higher, and we can see, you know, up to 24 is about the usual.
No, it's about 20. Yeah,
So he's 20. That's normal.
he's pretty relaxed.
And then as far as the heart rate, it's really important, and a lot of people that, you know, come from either small animal medicine or just haven't taken a heart rate on a horse will try and go to their chest because they're thinking, oh, it's up here. The best place to take it is actually right behind their left elbow.
Excuse me, could you turn them sideways?
Oh, yeah.
So we can-
We're moving.
Thank you.
There we go. There. And some of them, especially like I was saying, the very deep-chested horses, you really have to, you know, put some pressure on the stethoscope and really get into that elbow and the foreinguinal area to get a heart rate. And some of them, it can be really challenging to hear. And does anybody know what the normal, I guess it's on here, but normal heart rate for horses? So it's about 40. And if you have a horse that's really in shape and their cardiovascular system is used to some pretty strenuous work, I mean, it can go down to 30, 32. Other horses, it can go up to, you know, 48. So what was his? So 40. Yep, that's about the standard. The easiest way I find to do it is to just watch your watch and just do a count for 15 seconds and then multiply by 4. That way it should be around 10 heartbeats for 15 seconds, and then it's a pretty quick multiplication to 40.
And when you're listening, you'll hear lub dub, lub dub. So it's not just each single one is a count. You have to listen to both beats. That's 1. So lub dub 1, lub dub 2. So that's the easiest way. Is like you just have to be patient, and especially since their heart rate is slower. So if you listen to your own, it's a lot faster than theirs is. So
And you can hear the two distinct beats. And actually in horses, it's perfectly normal to hear all 4 heart sounds. So they have 4 valves in the heart. And in horses, because the heart rate is so slow, you can actually hear individually each valve closing in time. So if you hear like even 3 beats is normal, it just depends on the horse. So you could hear da da da, da da da, and that's just normal for that horse. And the other thing that we hear fairly commonly is arrhythmias, and in horses, it's a 2nd degree
heart block.
AV block.
AV block, thank you.
Come on.
So that's normal in horses, and it's typically seen with horses that are, again, in shape, and it's basically a skipped beat, but it has to be a regularly skipped beat. So they'll have like 3 normal beats and then a dropped beat. And that can actually be overridden if they get stimulated. So usually if you trot them out for, you know, a few steps, it will go away and you'll be able to, it will go back to just a regular rhythm.
And then another thing we hear on occasion.
You were turned sideways there. Where did you take the respiration rate at?
So you kind of, if you watch it in blank area, you'll see it kind of going in, going out. You
Okay.
can see it. That's what you watch.
All right.
You can also look at the nostrils.
You look at the nostrils.
It depends on the horse. Sometimes it's easier to see the nostrils flaring, but usually the most reliable place is on this light.
And then the other thing we generally hear from the heart is a heart murmur if the horse has something going on. And I don't know if you've you've ever noticed, your veterinarians, they check both sides. It's to hear all the valves. So you hear one side and then the other. Generally, the heart murmurs are easier to hear on the right side, but the heart is easier to listen to on the left.
And horses can develop heart murmurs as they age. So maybe last year your vet said, hey, everything sounds great, and this year they find a heart murmur. That's because a lot of horses will develop them in their late teens. And I mean, typically it's not something to absolutely freak out about. It's just something to be aware of, and it's something for the vets to be aware of, because there could be things that they need to take in account for the procedure that they're doing. So if we're having to sedate and your horse has a heart murmur, the vet may decide that it's not going to be a good idea to sedate the horse because they're cardiovascularly compromised. So that's why it's important that each and every time we see your horse, we're going to be doing a physical exam. Things change. Maybe it just wasn't noticed the last time. Murmurs are kind of tricky. Sometimes they're easier to hear than other days. So it's just, important for us to do this every single time we see your horse.
And if they do have something like a fever, we need to know prior to giving vaccinations. Even if you give your vaccinations at home, it's important to take the temperature first so that you know if they have a fever, you're not now adding this, killed vaccine to them, and now their immune system is going to have to kick into overdrive and have another problem. So, be aware of that so that you don't have reactions caused by things like that.
And likewise, if they already have a fever and we're now going to sedate them, that's going to interfere with that fever, and it's going to interfere with their natural ability to thermoregulate. So if they already are, spiking a fever and we sedate on top of that, it could cause that temperature to go up even further and, have more complications on top of that. So those are, some of the reasons that we're taking a TPR every time we see you. And it's also to screen for diseases. If you guys, trail your horse here and they have a fever, it's important for us to know, because you may be coming in for a lameness exam and, the horse may be, having something else going on, and we wouldn't want to introduce them to the general population in the hospital here. We have other patients that are already immunocompromised, and it's for your protection, it's for all the other horses on the property's protection, that we can isolate them at least while you're here.
So, last but not least is the temperature.
Everybody's favorite.
So, this is, can be tricky for a lot of horses. They don't like their hind end generally touched. So, it's good if you all, take their temperature, not every day obviously, but every once in a while, then that way they're comfortable with it, you're comfortable with it. You can call us and say, hey, my horse's temperature is elevated, what can we do here? And, they've been exposed to A, B, or C, or they just had their vaccine, now they have a fever, so, what can we do here? So that way, we know, and the horse is used to the temperature, so when they do get here and we have to take a temperature on a regular basis, they're not, panicking. It's fine. Gus is obviously really comfortable with all of this. And
Do you believe he fell asleep?
I'm not surprised. So we like to use the digital thermometers here. You'll hear from a lot of veterinarians that they still use the mercury. There's nothing wrong with that, but you do want to make sure you have a string attached or a really good grip, because if you lose that temperature or that thermometer in there and they suck it in, then potentially there could be a problem, because now you've got glass involved, so if it breaks, and then mercury, of course, mercury poisoning. So generally, if that does happen, we tend to leave it alone and it comes out most of the time, unless something happens and it does break off. But, so what you want to do is obviously be careful with their legs and where you are. lubricate, either just some water,
Natural lubrication.
whatever. So there are many methods. So whichever you would like. A little bit of water, a little bit of lube if you have some.
Is that a special thermometer or is it a human thermometer?
It's just a human digital thermometer, yeah. Because
think it says
it
that
still
something
reads the
on it,
same.
but-
You can either do Fahrenheit or Celsius. And I know on these digital ones, if you hold it down too long, it will change over to Celsius. So be aware of that. Be used to your thermometer before you go digital. Because then that'll cause different problems. So you want it to go in far enough so that the little tip is in there. You don't have to shove it in too far, but just enough to get a read. And
You'll notice she is standing off to the side. I know it's tempting to get really used to your own horse and say, I know how my horse is going to react in all situations, but we always say around here, just safety first. It's not worth getting hurt.
so his temp was 99.4. So is that normal? Checking. See if anybody was listening.
So things that could potentially alter a TPR, if you've recently given vaccines, it can often cause their temperature to go up, even if they're not having, a severe vaccine reaction. We will often see, just a little bit elevated temperature, and that's all, important information. Because if we've had situations where the owner gave a vaccine the day before we were trying to do a dental, and like I said before, we wouldn't want to sedate with a horse that already has an elevated temperature. Also, taking the vitals before you give any medication is very important, and then taking them again after you've given medication, especially if you're using Banamine or Bute, because those are being non-steroidal anti-inflammatories. They're also antipyretics, which are fever reducers. So if you have a colicky horse or have a horse that seems lethargic and you gave it Banamine and it says, oh well, it doesn't have a temperature. Well, was that before or after you gave the Banamine? Because that's going to be very important information for us to know to accurately assess the horse's condition.
Question?
Yeah.
How long do you wait to take it?
a lot faster. But yeah, that should give you an idea of whether it's working or not, bringing it down.
Can you talk about where you could listen to gut sounds that were
Yes. So, for the gut sounds, we've got 4 quadrants. So you've got the upper left quadrant, lower left quadrant, upper right, lower right. So you would listen generally in the area right in front of the flank. So both above and below. And then you would hear, gut sounds. So if you hear nothing, that doesn't necessarily mean the end of the world, but if you have a colicky horse and you hear nothing, that's not great, especially if they've eaten something and you've got no digestive sounds going on. So we want something, even if it's small sounds. And again, if you listen to your horse regularly, you'll know like what they sound like, because we have like really super fast gut sounds that are kind of like really gurgly, and that's borborygmin. And so it's really loud, it's really quick, and it's intense, but that could mean another thing. So
I've got a question for you. On the capillary refill, what are you checking when you do that?
So you're checking perfusion, so that's basically telling you how well their cardiovascular system is working, how well they're getting blood to those extremities and those tissues. So if you depress a mucous membrane, and so you're basically squeezing all the blood from that tissue, how fast is it taking the horse's cardiovascular system to replenish that tissue?
Okay. Is there a certain time limit?
So normal is about under 2 seconds. So if you say 1/100, 2/100, so that's normal. This would be a really good thing to take if your horse has had a
So if it's a deep red, you've got a circulation problem?
If it's deep red, that would indicate infection, correct? So if they have a systemic infection, then yeah, they would have the deep red, like brick colored gums.
And then the other thing we didn't cover is how to check if you don't have a lovely stethoscope at home. If you didn't buy one from Loomis Basin Equine, that'd be good. So there's a few places that we could check. One is under the jawline, so you can just kind of feel around there. And this is kind of hard if you've never done it before to feel for. And even if you have, some horses are a little bit, easier than others. So, but yeah, so you can just kind of feel for a pulse under there, and then take it that way. It's a little harder because you're using the tips of your fingers, which aren't as easy. You can't hear what the heart actually sounds like, but it'll give you a number at least. And then I don't know if any of you have had lame horses. What do they check for? Pulse, the digital pulse. So you come down here and you can feel for that, which could, if you have that bounding pulse or any problem, then that could indicate that you've got laminitis or something else going on. So, but that's another part you can check.
Radio.
So, and then the radio. So back in the inside of the knee. So you're gonna just feel right back here. Where is that? Can't see from here.
There, we can
I'll turn him again.
turn our beautiful model.
Right behind the back of the knee. So, and there are other places, but
Those are usually the easiest ones to access.
yeah. Any other questions? Who wants to try to listen? And have most of you taken